In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 25 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 1. Why do you want to work in a community pharmacy? The following are guidelines on how to approach this question. A strong response to this question requires demonstrating a genuine passion for community pharmacy, patient-centered care, and clinical expertise. Employers ask this question to assess the candidate's motivation, understanding of the role, and commitment to providing high-quality pharmacy services. The interviewee should emphasize their interest in direct patient interactions, medication counseling, and improving public health. Additionally, discussing skills such as communication, problem-solving, and adaptability will show suitability for the role. When answering this question, avoid generic responses that lack personal insight or fail to demonstrate an understanding of the unique responsibilities of a community pharmacist. A key regulation to be aware of is the Pharmaceutical Society of Ireland, PSI, guidelines on patient-centered care, which emphasize a pharmacist's role in ensuring safe and effective use of medicines. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I have always been passionate about helping people manage their health, and working in a community pharmacy allows me to make a direct impact on patient care every day. I enjoy building relationships with patients, offering expert medication advice, and ensuring they use their medicines safely and effectively. The role of a community pharmacist is dynamic, involving not only dispensing but also health promotion, screening services, and working closely with general practitioners and other healthcare professionals. I am particularly interested in the clinical aspects of community pharmacy, such as medication reviews, minor ailment management, and vaccinations, which contribute to better health outcomes. I believe my strong communication skills and clinical knowledge will allow me to support patients effectively while ensuring adherence to PSI guidelines and best pharmacy practices. Example scenario. I remember when a patient with poorly controlled asthma came into the pharmacy requesting a refill of their short-acting beta-agonist inhaler. Through a quick discussion, I realized they were over-relying on their reliever inhaler and had poor adherence to their corticosteroid inhaler. Recognizing this as a potential risk for exacerbations, I took the time to educate them on proper inhaler technique, the importance of adherence to their preventer inhaler, and signs of worsening asthma. I also conducted a medicine use review, MUR, and referred them to their GP for a review of their asthma management plan. As a result, the patient improved their adherence, reduced their reliance on their reliever inhaler, and expressed gratitude for the support. This experience reaffirmed my belief that community pharmacy is an essential part of primary healthcare, providing opportunities to improve patient outcomes through direct interventions and education. Question 2. What experience do you have with dispensing medications? The following are guidelines on how to approach this question. Employers ask this question to assess a candidate's technical competency, accuracy, and familiarity with pharmacy procedures. A strong response should highlight experience with prescription processing, patient safety, legal compliance, and working with healthcare professionals. The interviewee should demonstrate their attention to detail, ability to handle high-pressure situations, and knowledge of dispensing software. Additionally, mentioning patient counseling and adherence to regulations strengthens the response. When answering this question, avoid vague or overly general responses that do not showcase hands-on experience. In Ireland, pharmacists must comply with the Medicinal Products, Prescription and Control of Supply, Regulations 2003 and follow the Pharmaceutical Society of Ireland, PSI, guidelines on good dispensing practice to ensure legal and ethical dispensing. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I have extensive experience in dispensing medications safely and accurately in a busy community pharmacy setting. I am proficient in interpreting prescriptions, identifying potential drug interactions, and ensuring compliance with legal and ethical standards. My role involves using dispensing software to process prescriptions efficiently while verifying dosage, contraindications, and patient history. I also provide patient counseling, ensuring individuals understand their medication, including dosage instructions, side effects, and interactions. Additionally, I work closely with general practitioners and other healthcare professionals to resolve prescription queries and optimize patient care. Accuracy, efficiency, and adherence to PSI guidelines are central to my approach, ensuring patient safety and the highest standards of professional practice. Example scenario. I remember when a patient presented with a prescription for warfarin and ibuprofen, which raised a red flag due to the risk of increased bleeding. Upon reviewing the patient's history in the dispensing system, I noticed that they had a history of peptic ulcers, making the combination even more concerning. I immediately contacted the prescribing GP, who confirmed that the ibuprofen was an oversight and adjusted the prescription to a safer alternative, such as paracetamol. I then cancelled the patient, explaining the importance of avoiding over-the-counter NSAIDs while on warfarin. As a result, a potentially serious adverse event was prevented, reinforcing the importance of vigilance in dispensing. Question 3. How do you handle a prescription that appears to have a potential error? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's problem-solving skills, attention to detail, and patient safety awareness. They expect candidates to demonstrate strong clinical judgment, communication skills, and adherence to legal and professional guidelines. The ideal response should emphasize collaboration with prescribers, thorough verification, and patient-centered care. Pharmacists must also highlight their ability to remain calm, professional, and proactive in resolving prescription discrepancies. When answering this question, avoid blaming prescribers, making assumptions without verification, or taking independent action without consulting the appropriate sources. In Ireland, pharmacists must comply with the Medicines Act 2007, the Misuse of Drugs Regulations 2017, and PSI's Guidelines on the Safe Supply of Medicines, which emphasize the importance of ensuring prescriptions are accurate and legally valid before dispensing. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I encounter a prescription that appears to have a potential error, my first step is to carefully review the details, including the drug name, dosage, strength, frequency, and patient's medical history, to determine the nature of the issue. If the error is minor, such as a missing prescriber's registration number, I follow standard pharmacy procedures to obtain clarification. However, if the issue involves a potentially harmful dose, drug interaction, or contraindication, I immediately contact the prescriber to discuss my concerns while maintaining a professional and collaborative approach. My priority is always patient safety, and I ensure that I clearly document any interventions made in accordance with PSI guidelines and professional indemnity requirements. If necessary, I also communicate with the patient to explain any delay and provide reassurance that their medication will be dispensed safely. Example scenario. I remember when a patient presented with a warfarin prescription for 10 mg daily, which seemed unusually high. Upon reviewing the patient's history and INR levels, I identified that their usual dose was 3 mg daily. I immediately contacted the prescriber, who confirmed that it was a transcription error. The correct dose was meant to be 1 mg 3 times a week and 3 mg on other days. By taking prompt action, I prevented a potential overdose that could have led to serious bleeding complications. I also explained the situation to the patient, reinforced the importance of monitoring INR levels, and ensured they had clear instructions on how to take their medication correctly. This experience reinforced the critical role pharmacists play in preventing medication errors and ensuring patient safety. Question 4. What steps do you take to ensure patient confidentiality? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's commitment to patient privacy, knowledge of data protection laws, and ability to implement best practices in a busy community pharmacy setting. The interview expects the candidate to demonstrate an understanding of confidentiality protocols, secure handling of patient records, and discreet communication with patients and healthcare professionals. The response should highlight adherence to GDPR, the Pharmacy Act 2007, and PSI guidelines on patient confidentiality. It is crucial to emphasize proactive measures, such as secure storage of prescriptions, verifying patient identity before discussing sensitive information, and ensuring private consultations when necessary. When answering this question, avoid vague responses or failing to mention legal and professional obligations. Under GDPR and PSI Code of Conduct, pharmacists must ensure that patient information is only shared on a need-to-know basis and handled with the highest level of discretion. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Ensuring patient confidentiality is a fundamental part of my role as a community pharmacist, and I strictly adhere to GDPR regulations, the Pharmacy Act 2007, and PSI guidelines to protect sensitive information. I ensure that patient records and prescriptions are securely stored and accessed only by authorized personnel. When discussing medications or health concerns, I maintain a low, discreet tone and, when necessary, invite the patient to a private consultation room to prevent unauthorized disclosure. I always verify a patient's identity before sharing sensitive information and ensure that phone conversations regarding prescriptions are handled securely and professionally. If a patient requests someone else to collect their medication, I obtain explicit consent and verify the relationship to avoid breaches of confidentiality. Lastly, I continuously train and remind staff about best practices to maintain strict patient privacy at all times. Example scenario. I remember when a patient's family member came in to collect their prescription for an antidepressant but had no prior authorization. The family member insisted that they had been picking up prescriptions for years, but I politely explained that due to confidentiality laws, I could not release the medication without the patient's explicit consent. I discreetly contacted the patient and obtained their verbal consent, ensuring that it was documented in their patient record. This approach reassured the patient that their privacy was respected, while also allowing them to receive the medication they needed through their chosen representative. The patient later expressed appreciation for the professionalism and diligence in protecting their sensitive health information, which reinforced their trust in our pharmacy. Question 5. How do you handle a situation where a patient requests an OTC medication that is not suitable for their condition? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to apply clinical judgment, communicate effectively with patients, and adhere to ethical and professional responsibilities. The interview expects the candidate to demonstrate strong knowledge of pharmacology, patient-centered care, and the ability to manage potentially difficult conversations while maintaining professionalism. The response should highlight good communication skills, the ability to educate and advise patients, and a patient safety-first approach. It is essential to show how the pharmacist balances customer service with legal and professional obligations, ensuring that the patient receives the most appropriate treatment. When answering this question, avoid being dismissive or confrontational with the patient, as this may damage trust and rapport. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. As a pharmacist, my priority is always patient safety and ensuring the medication is appropriate for their condition. If a patient requests an OTC medication that is not suitable, I would first politely inquire about their symptoms and medical history to understand their needs better. I would then explain why the requested medication may not be the best choice and offer a more appropriate alternative. If necessary, I would recommend non-pharmacological interventions or suggest that they seek medical advice from their GP. Throughout the conversation, I would maintain a professional and empathetic approach, ensuring the patient feels heard and supported in making an informed decision about their health. My goal is to provide the best possible care while adhering to professional and legal responsibilities. Example scenario. I remember when a middle-aged patient with hypertension came in requesting pseudoephedrine for nasal congestion. I asked about their symptoms and found they had been experiencing a cold with nasal blockage. Given their hypertension, I explained that pseudoephedrine could elevate blood pressure and pose a risk. Instead, I recommended a saline nasal spray and steam inhalation and advised them to consult their GP if symptoms persisted. The patient appreciated the explanation and took my recommendation. This experience reinforced the importance of patient education and clinical judgment in ensuring safe and effective medication use in a community pharmacy setting. Question 6. How do you keep up to date with changes in pharmacy laws and new medications? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's commitment to continuous professional development, CPD, and their ability to stay informed about changes in legislation, clinical guidelines, and new medications. The best approach is to demonstrate a proactive learning mindset, highlighting specific resources, professional memberships, and learning strategies used to remain current. Emphasize the use of trusted sources such as the Pharmaceutical Society of Ireland, PSI, the Health Products Regulatory Authority, HPRA, and the HSE, as well as participation in CPD courses, pharmacy conferences, and peer discussions. Show an understanding of how staying up to date ensures patient safety, legal compliance, and evidence-based practice. When answering this question, avoid vague or generic statements that do not specify actual learning methods or sources. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. To stay informed about changes in pharmacy laws and new medications, I actively engage in continuous professional development, CPD, ensuring my knowledge aligns with the latest legislative updates, clinical guidelines, and drug advancements. I regularly consult trusted sources such as the PSI website, HPRA updates, the British National Formulary, BNF, and HSE guidelines, and I subscribe to pharmacy journals like the Irish Pharmacy Journal. Additionally, I attend PSI-accredited CPD training sessions, pharmacy conferences, and webinars to enhance my knowledge and professional practice. To stay current on new medications, I review HPRA-approved drug updates, manufacturer leaflets, and clinical trials while also engaging in discussions with colleagues, prescribers, and pharmaceutical representatives. By keeping up to date, I ensure that I provide accurate information to patients, make evidence-based clinical decisions, and remain compliant with Irish pharmacy regulations. Example scenario. I remember when a new anticoagulant was added to the formulary, and patients started asking about its differences compared to existing options. I had recently completed a PSI-accredited CPD module on anticoagulants and reviewed HPRA and HSE updates about its indications, dosing, and contraindications. A patient on warfarin asked whether they could switch, and thanks to my up-to-date knowledge, I explained the differences in monitoring, interactions, and side effects. I also discussed the case with their GP, ensuring a safe and informed transition based on the patient's clinical needs. This experience reinforced the importance of staying current, as it directly impacts patient safety, adherence, and clinical outcomes. Question 7. Can you describe a time when you had to deal with a difficult customer? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's communication skills, conflict resolution abilities, and professionalism in handling challenging situations. A strong response should demonstrate patience, empathy, active listening, and problem-solving while ensuring that patient safety and customer satisfaction remain priorities. The interviewee should provide a structured response that acknowledges the issue, explains the steps taken to resolve it, and highlights the positive outcome. It is crucial to show that they remained calm, followed pharmacy policies, and maintained a professional and ethical approach throughout. When answering this question, avoid speaking negatively about the customer, placing blame, or showing frustration. A pharmacist should be aware of the Pharmaceutical Society of Ireland, PSI, Code of Conduct, which outlines the duty to treat patients with dignity and respect while maintaining professional integrity. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I believe that handling difficult customers with patience and professionalism is a vital part of being a community pharmacist. I always aim to listen attentively, acknowledge concerns, and offer a solution that aligns with professional standards and pharmacy regulations. One instance that stands out is when a customer was upset because their prescription could not be dispensed due to a missing valid prescription. Instead of dismissing their frustration, I calmly explained the importance of prescription validity for patient safety and legal compliance. I then offered to contact their GP surgery on their behalf to facilitate a resolution. By maintaining a polite and reassuring tone, I was able to de-escalate the situation, and the patient ultimately appreciated the assistance. Example scenario. I remember when a patient came into the pharmacy in distress, demanding an early refill of their controlled medication, which I could not dispense without a valid prescription. The patient became agitated, insisting that they had received an early refill before. I acknowledged their frustration and calmly explained the legal restrictions on controlled drugs under Irish medicines regulations. I then reassured them that I would contact their prescriber to discuss the situation. After speaking with the GP, it was confirmed that an alternative medication could be issued that would meet the patient's needs while remaining compliant with regulations. By staying calm, following protocol, and providing a safe and legal solution, I was able to turn a tense situation into a positive patient interaction. Question 8. How do you handle medication shortages or supply chain issues? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's problem-solving skills, adaptability, and ability to maintain patient care during medication shortages or supply chain disruptions. The interviewee should demonstrate strong communication, resourcefulness, and regulatory knowledge while highlighting their ability to collaborate with healthcare providers, wholesalers, and patients to find suitable alternatives. The response should emphasize a patient-first approach, ensuring continuity of care while adhering to pharmaceutical regulations. When answering this question, avoid focusing solely on logistical challenges without addressing patient safety and professional responsibility. In Ireland, pharmacists must adhere to the Pharmaceutical Society of Ireland, PSI, Code of Conduct, ensuring that any alternative medication provided is clinically appropriate and communicated transparently to the patient and prescriber. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In situations where a medication shortage arises, my priority is to ensure patient safety and continuity of care. I begin by verifying the shortage with our supplier and exploring available stock in alternative pharmacies or wholesalers. If the medication is unavailable, I consult the prescriber to recommend a clinically suitable alternative, whether it be a therapeutic equivalent or a different formulation. Communication is key, so I make sure to inform the patient about the situation, explaining their options and ensuring they understand any changes to their treatment. I also proactively monitor shortage trends and maintain close relationships with wholesalers and suppliers to anticipate and manage future supply challenges effectively. In line with PSI guidelines, I ensure all decisions are documented, and the prescriber's approval is obtained where necessary. Example scenario. I remember when a national shortage of estradiol patches affected many patients relying on hormone replacement therapy. A patient presented with a prescription but was unable to obtain their usual dose. After confirming the shortage with the supplier, I contacted the GP to discuss alternative options, such as other estradiol patch brands with equivalent dosing or switching to an oral formulation. The GP agreed to prescribe Everil patches, and I carefully explained the new dosing regimen and application instructions to the patient. By acting quickly and maintaining open communication with the prescriber and patient, I ensured the patient's treatment was not interrupted, reinforcing trust in the pharmacist's ability to handle supply challenges efficiently. Question 9. What would you do if a patient presents with symptoms that require medical attention but insists on self-medicating? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to balance patient autonomy with professional responsibility while ensuring patient safety. The interviewee should demonstrate strong communication skills, clinical judgment, and ethical decision-making. The response should emphasize active listening, patient education, and the ability to persuade patients to seek appropriate care. The pharmacist should also show an understanding of the scope of their professional responsibility, particularly in cases where delayed medical intervention could worsen a condition. When answering this question, avoid being dismissive of the patient's concerns or making a recommendation that could compromise patient safety. Under the PSI's Code of Conduct, pharmacists must prioritize patient well-being and ensure that interventions align with evidence-based practice and legal responsibilities. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient presents with symptoms that require medical attention but insists on self-medicating, I will first engage them in a respectful and empathetic conversation to understand their concerns. I would explain why their symptoms indicate a more serious condition and the potential risks of delaying medical assessment. To encourage compliance, I would provide clear, evidence-based information on why a consultation with a GP or emergency services is necessary. If they remain reluctant, I would explore any barriers preventing them from seeking care, such as cost, fear, or time constraints, and offer practical solutions, such as helping them contact a healthcare provider. If the condition is severe and refusal to seek care poses an immediate risk, I would consider escalating the matter by involving a family member or, in extreme cases, emergency services while ensuring my actions remain within my professional and legal boundaries. Example scenario. I remember when a middle-aged man came into the pharmacy complaining of persistent chest pain and asking for a stronger antacid. After questioning him further, I discovered he had risk factors for cardiovascular disease and that the pain had been occurring on exertion and radiating to his arm. I explained to him in a calm but firm manner that his symptoms could indicate a serious cardiac issue rather than simple indigestion. He was hesitant about going to the hospital, fearing it was unnecessary, but I emphasized the risks of a potential heart attack and the importance of immediate assessment. Eventually, he agreed to let me call an ambulance, and it was later confirmed that he had unstable angina, requiring urgent medical intervention. This experience reinforced the importance of effective communication and clinical awareness in guiding patients toward the appropriate level of care. Question 10. How do you approach patient education on medication adherence? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to communicate effectively, provide clear patient education, and ensure medication adherence for better health outcomes. The best approach to answering this question is to highlight strong communication skills, patient-centered care, and problem-solving abilities. A pharmacist must demonstrate their ability to tailor information to the patient's needs, use layman's terms when necessary, and address any barriers to adherence such as cost, side effects, or misconceptions. It is also important to show empathy, active listening, and cultural sensitivity when engaging with patients. When answering this question, avoid giving a generic or overly technical response without considering individual patient circumstances. In Ireland, adherence counselling should align with the PSI guidelines on the safe supply of medicines, ensuring compliance with patient confidentiality and the duty of care. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When educating a patient on medication adherence, I take a patient-centered approach by first assessing their understanding of the medication and identifying any concerns they may have. I use simple and clear language to explain the importance of adherence, the potential consequences of missed doses, and how to incorporate the medication into their daily routine. If a patient is struggling, I explore the reasons, whether it's due to side effects, cost, forgetfulness, or lack of motivation, and offer practical solutions such as reminder apps, blister packs, or lifestyle adjustments. I also emphasize the importance of follow-up, encouraging patients to reach out if they experience any issues or need further clarification. Ultimately, my goal is to empower patients with the knowledge and confidence to take their medications correctly and achieve the best possible health outcomes. Example scenario. I remember when a middle-aged patient with type 2 diabetes frequently missed his metformin doses due to a busy work schedule and forgetfulness. I started by listening to his concerns and then explained how consistent medication use helps maintain stable blood glucose levels and prevents complications like neuropathy and cardiovascular disease. To support him, I suggested setting alarms on his phone and switching to a once-daily extended-release formulation, which he found more manageable. At his next visit, he shared that these adjustments had significantly improved his adherence, and he felt more in control of his health. This experience reinforced the impact of personalized patient education and the importance of finding practical solutions tailored to each individual's lifestyle. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.